beautiful building with the best acoustics ever. Makes me want to burst into song. Actually, what really wants to make me burst into song is why we're all here today. And I'm so pleased to be joined by so many critically important partners in the development of this legislation. You see, of course, behind me our faithful paramedics who have always brought to bear such important advice about how we can do the very, very best that we can for Manitoba families in emergency situations. The Heart and Stroke Foundation, also an incredibly important partner, as you're about to hear in some of my remarks. I'm also joined by my colleague, Bonnie Korzenowski, the MLA for St. James, who has been a passionate advocate on this subject for many, many years. So I'm just delighted that you can be here today, Bonnie, along with the rest of us. We know that when someone experiences cardiac arrest, that rapid treatment literally means the difference between life and death. The experts in cardiac care use the expression, time is muscle. Oh, I also see Leanne Rowett over here. I'm glad that you can be here as well. MLA from Manitoba. Sorry I didn't see you before. Cardiac arrest, of course, strikes quickly, most often without warning, and most of the time outside of a health facility. These can occur in public places like airports and arenas and gyms and recreation centers. And we know from all of our partners standing here today and more that defibrillators can make that life and death difference in much the same way our firefighters would tell us as a fire extinguisher can. They're portable, they're easy to use, voice prompt instructions, virtually no training required, which may surprise a lot of Manitobans. Over the last several months, of course, we've been working with the partners that I've mentioned to you about how to improve access to defibrillators here in Manitoba. And just a few hours ago, I was very pleased to introduce the Defibrillator Pubic Access Act, which will require life-saving defibrillators to be installed in high-traffic public places. You may know that this legislation, or this kind of legislation, is not, particularly uncommon in the United States, but I understand that this will be the first government-introduced legislation in Canada, and we're very, very proud of that. In addition to requiring defibrillators in the most high-risk places, such as high-traffic schools, airports, recreation centers, this new law will include additional requirements based on the advice of our partners that will support rapid public access by, number one, requiring that signs be posted to identify the location of the defibrillator, and two, requiring that the equipment be registered so that 911 dispatchers can assist a bystander in finding the defibrillator and using it while the ambulance is on its way. I probably shouldn't tell you this, but I will. We have a defibrillator here at the Manitoba Legislature. Hands up, those of you that knew that. 2 people. What good would that, and the Heart and Stroke Foundation. It would be great if you were here all the time. What good really would that have done us? We know that we have actually a couple of them located here in the building, but it's a really good example of why we believe this legislation is really going to help us. Because going forward, it'll be required that we have a sign that tells people that there's a defibrillator on site and that they can have access to it. And the legislature will be required to have this registered so that if something were to happen here in the People's Building and 911 was called, they could direct us to where that defibrillator was located so that we could use it when it matters most. A very instructive piece of information, I assure you. The Heart and Stroke Foundation which of course has been a leader in this area, maintains now a voluntary registry, which has grown from only about 80 defibrillators or so in 2008 to over 600 of them registered today. And we really welcome and appreciate their offer to continue maintaining what will become the Manitoba Registry going forward. To assist assist with introducing defibrillators into more public places, we're going to work with Heart and Stroke. We're going to work with medical experts, community stakeholders, paramedics, of course, to identify the types of places that are most at risk for cardiac arrest, to be designated as requiring a defibrillator to be on site. They're going to prioritize for us these places first, these places next, and so on. We're also going to ensure that community recreation centres and public schools found to be most at risk can access funding support through existing grant programs. This, I believe, in other contexts has been a criticism of this kind of concept, and we want to do whatever we can to support the financing of these defibrillators in places where we believe they can be of the most use in public areas. It is my distinct privilege now to introduce to you the CEO of the Heart and Stroke Foundation, Ms. Debbie Brown, who's going to make a few comments about what we believe to be really exciting news today. Ms. Brown.
Good afternoon, everyone, and thank you very much, Minister Oswald, for those kind remarks. I'm here to commend the Manitoba government for introducing legislation that will give more Manitobans access to publicly placed automated external defibrillators, also known as AEDs. Far too many Manitobans die each year from sudden cardiac arrest in public places, in the workplaces, and even at home. Heart disease and stroke are the leading cause of death in Manitoba, accounting for nearly 3,700 deaths annually. Many of these deaths in Winnipeg are the results of cardiac arrest. 911 receives approximately 3 calls of cardiac arrest per day. So that's quite significant, 3 calls per day in Winnipeg alone. Bystander CPR and early defibrillation have been significantly associated with increased survival rates for people in cardiac arrest. The odds of survival for an out-of-hospital arrest are normally at a dismal 5%. Yet, if an AED is immediately available and used to provide defibrillation along with CPR, survival rates from sudden cardiac arrest can increase by over 75% or more compared to just using CPR alone. So that's a big increase. But there's also one important caution. With each passing minute after a cardiac arrest occurs, the probability of survival decreases by 7 to 10%. So after 12 minutes have elapsed, the chance of saving a life approaches 0. So when somebody goes into cardiac arrest, there really is no time to waste. Manitobans do not have to die of cardiac arrest. Immediate access to defibrillator could mean the difference between life and death. With this in mind, for many years, the Heart and Stroke Foundation has been advocating for the placement of AEDs in all public places and encourages all Manitobans to learn CPR. We're looking forward to the day when the placement of AEDs in any public place is as common as fire extinguishers. And also, we want to make sure that many more people are trained and learn CPR to save a life. This legislation is a great and important step towards creating a heart health environment in Manitoba. We fully support and thank the Manitoba government for moving forward with this initiative today. Thank you.
Thank you so much, Ms. Brown, for your kind comments. It's my privilege now to introduce to you Mr. Chris Broughton, local paramedic, and the president of MGEU Local 911 to say a few words.
Thank you very much. First, I'd like to begin by extending my thanks to Health Minister and her staff for having us here today, this afternoon, to celebrate this important and truly groundbreaking day. Today, because of the work of many people in this room, more Manitobans will survive heart attacks and cardiac arrests. It's really just that simple. The fact of the matter is, cardiac arrests occur outside the hospital 85% of the time. They often have